There are so many things that are special about Simmons grads. I could talk to you all day. I see them out there every day, making a difference in patients' lives, making change, being leaders. They are rock stars, all of them, and we've been doing this for over 100 years.
I could not be prouder of the reputation of Simmons. We have been recognized as one of the top nursing programs in the country. What makes the clinical education program of Simmons unique is that we begin our clinical practice with our students very early on in the curriculum.
We really focus on clinical preparation. We require more than 700 hours of clinical preparation in the Family Nurse Practitioner program, and there's really only 500 hours that are required by the certification agencies.
The simulation labs were fantastic. They were definitely nerve-wracking.
What's going on? Please, nurses!
Everything's gonna be okay.
Dad!
But you're right there alongside your whole cohort of students, and you go in and you get to simulate what you actually would do in caring for a patient. So that's quite a remarkable thing, to be able to have such a realistic experience prior to getting to the hospital.
So when the nursing students from Simmons come to the Dana-Farber, they're a perfect student for us to hire because they've had the clinical nursing student experience, and then they come in and they're ready to hit the ground running.
Simmons was very special compared to other schools because I was a person, I was an individual, and people treated me that way. And I felt like they saw my special skills and areas where I could build upon my nursing career to make me a practitioner. And that was really important to me because in a bigger school with less individualization, I probably would have just said, forget it.
All of my professors, they go above and beyond for all the students. We have small classes, everyone knows everyone, they address you by name. It's impressive.
One of the main things I like best about working with the nursing students at Simmons is that it's a very diverse population. Probably about 25 to 30% of our students are diverse. They are committed to diversity at this school as far as bringing in many different cultures. Even in the Dotson program that I work in, we have 32 different languages spoken just in that program.
I'm initially from New York City, and I wanted to come to Boston because of the city feel, and I'll be able to do what I love, which is helping people and giving them the care that they need. And I feel like Simmons is going to put me in the position to do that.
The graduates that I worked at with Simmons, I think, come out more fully formed. Actually, the first student that I took on as a Simmons student at Mass General basically set the bar so high that it's made it almost difficult for other people.
What makes Simmons Clinical Education Program unique is the connectiveness that we have with our clinical faculty and our clinical institutions.
We are here in the Valhalla, if you will, of the medical establishment in Boston, and some would argue in the United States, and there are those who would argue in the world, some of the best. And our students have placements in those institutions, and they're getting some of the best exposure. It prepares students for the challenges of working in the medical field, both now and what is going to be coming for the future.
I actually was given some criticism once that the program was too hard, and I turned around and I said, you know what, that's the best compliment I could ever receive. Yes, it is hard, and do you want to be a mediocre nurse or do you want to be an exceptional nurse? And we prepare only exceptional nurses here at Simmons. And when they graduate and they come back, they say, it was tough, but it was worth it, and I am a great nurse thanks to you.